Last week, Clark County health officials warned that RSV cases are up 200% from last winter. Tonight, we're now learning how many kids the virus is sending to Nevada hospitals. Take a look at this. It's the trajectory of pediatric patients all since late last month. This is all according to the Nevada Hospital Association. There was that spike a week ago, right after Thanksgiving, then an uptick after the weekend with roughly 100 children in the hospital. Officials say that's putting tremendous stress on our healthcare system. And outpatient treatment comes with its own challenges as parents struggle to find medicine. Fox 6's Drew Andre joining us live with what's causing the strain on supply and families getting frantic.
Well, Jacqueline, whether it's big chain pharmacies or small independent ones, they're all running into the same sort of shortages when it comes to kids' medicine. And one local pharmacist we spoke with says it's largely because of panic buying. Frustration sets in when you find empty shelves when looking for medicine for your sick child. It's a triple threat this season: RSV, COVID, and the flu.
This is the first time that this panic thing is going on. I haven't seen this in the past 25 years practicing as a pharmacist. I've never come across this like this before.
Local pharmacists are seeing medicine meant for kids flying off the shelves, largely liquid antivirals and antibiotics, especially the common over-the-counter meds like Motrin and cough syrup.
Those are the ones that went out very fast.
The Nevada State Board of Pharmacy tells us the shortages stem from pharmacies not ordering enough of a certain drug that it needs during a spike in illness. And the other reason is a production issue,
where there's been a consolidation. And so we used to have many more people making it, and now it's less people making more of it. And so when you lose one of those, it can be, dire onto the system.
Wiest says for prescription drugs, pharmacists can talk to doctors and change their meds to something else that's similar.
And then they could switch it to maybe another therapeutic or different drug. And that can all happen without the patient having to go back to the doctor's office.
Yeah, this is where I'm really stuck up, this ibuprofen.
Owner of Belmont Pharmacy on Bonanza, Bobby Benson, says he's worked hard with vendors to keep the meds in stock, but the public can help manage the issue too.
Everybody's buying, even those who don't need it. So I would suggest that they should just chill. Buy what you need to stop the hoarding.
Benson does believe, though, that the shortages will be resolved soon because there's a lot of pressure on manufacturers to keep up with that demand. The FDA says they're monitoring the situation. Jacqueline?